Good morning and happy Valentine's Day. Today on Spotlight, we'll focus on what seems to be a loving new partnership, so to speak, between Michigan State University, based in East Lansing, and Detroit's Henry Ford Health System. They are two of our state's leading education, research, and health institutions. Together, can they transform healthcare in the Great Lakes State with their 30-year commitment? And what does this ambitious union mean to all of you? We'll ask Dr. Adnan Mukhara, Chief Clinical Officer of the Henry Ford Health System, and Dr. Norman Beauchamp, Jr., Executive Vice President of Health Sciences at Michigan State. And later on our Sunday morning program, we'll remember two women who made history. It's Sunday, February the 14th. I'm Chuck Stokes, and this is Spotlight. Doctors, welcome to Spotlight. I hope you both are being very safe in this rather interesting times. Thank you for joining us today.
Thank you.
Thank you.
Dr. Mukhara, I'm going to begin with you representing the Henry Ford Health System. This is a 30-year partnership. I understand that this is historic. Why?
We are really very excited about this long-term partnership because it brings two institutions with legacy, tradition, and strong foundation for innovation and research to be able to bring our resources together to drive and continue to build on those traditions. We have been, both Henry Ford Health System and MSU are known for their commitment to drive transformation in healthcare, which is highly needed. It's highly needed not only in our region, in our state, but across the nation. And we really believe by coming together, bringing our researchers together, bringing our clinical teams together, bringing our educators together, we'll be able to continue to build on that foundation for innovation and transformation.
Quick follow-up before I go to Dr. Beauchamp. You tried to do something a little similar to this with Wayne State University a couple years ago. That ran into some roadblocks. What made this an easier hurdle to get over?
Well, I think there are a few things. There are a few things that we have as we build our academic strategy on the Henry Ford Health System side. We were able to delineate what are our priorities going forward. There is no question that the leadership that Dr. Norm Beauchamp and Dr. Sam Stanley, the president of the university, and their teams have brought to the table, and kind of sharing our lessons learned from prior experiences have helped navigate that further than we had before. And there is no question that the board support from both sides have been instrumental into making sure that we are on the right track for that.
Sure. Dr. Beauchamp, talk about from the perspective of Michigan State University, one of the premier universities in this state, obviously has a big footprint all across this state. What do you get out of this partnership?
Yeah, thank you. And thanks for having us today. For us, our goal is to bring health, hope, and healing to people. Too many people in our communities in our state don't have access to health, hope, and healing. And we feel that to do this right, you have to fully integrate clinical care, education, and then finding new ways to deliver care. Michigan State does about $800 million a year in research, and by having a partner that also has the core value of research as well as an incredibly broad clinical delivery system, you can then connect the discovery to bringing care to people. And then as you bring that care, you can determine what else is needed by the communities you serve. And then that drives the next level of discovery. So it really comes together in a powerful way to identify gaps in care, to identify access, find the solutions, and then through our large combined education program, bring that back through to the communities we serve.
Sure. We're dealing with the COVID-19 pandemic, but we hopefully will get past that relatively soon. But in terms of one of your major goals on this, in terms of care and service, I understand is going to concentrate on cancer and cancer research and treatment and care. Is that correct? That can go to either one of you, perhaps Dr. Mukhara?
Yeah, so definitely cancer is one of the main focus, but not the only focus. But let's talk a little bit about cancer. We believe that in order to provide the best care in cancer, you need to continue to link that research, state-of-the-art innovation to cancer care. because cancer care is evolving on a regular basis. If I look at being a cancer specialist myself, if I look at where cancer care was a decade and 2 decades ago, the transformation and innovation that has happened in the past few months and past few years is enormous. And our ability at Henry Ford Health System to provide the best has been really embedded in the fact that we are able to bring that research and innovation. We decided with Michigan State University that we need to bring our resources together, because when we get two strong institutions that are able to understand the need of connecting research and innovation to healthcare, we are going to win. It is by adding 1 and 1, it's not going to be 2 or 3, it's going to be 4 and 10. It is synergistic. It really amplifies our ability to provide the best care to our communities. And as importantly, cancer care is embedded not only in innovation and transformation in care with respect to the biology of the cancer, but how we reach out to our community. We know that there are significant health disparities in outcomes as it relates to cancer, whether it is related to our minority population that we serve in Detroit, or minority population in certain rural areas. How do we reach out to them? How do we deliver the best care to them has been a challenge, and not only in Michigan, but across the nation. And this is really where we believe that the strength and innovation that Michigan State University has had and that we have at Henry Ford Health System will help us address not only innovation in the science of cancer care, but in the delivery of cancer care across our populations and communities.
Sure. Dr. Beauchamp, what's the biggest challenge that you face in pulling this off? You're in a very, very competitive industry and a field in which all the hospitals are trying to have a big footprint, but they're also battling each other for health and services.
Yeah, I would say, and it's that trust and establishing trust was really the foundational piece to this. And once you could establish that the core values were the same and the outcomes, which were to serve people together, and an approach that was a win-win. How could you help both organizations meet their mission? Things actually came together remarkably quickly. So by keeping the focus on the purpose, the challenges are really falling away. I think the other piece that is that to be successful, you have to communicate often and with people. What's the purpose? How will this fit with my mission as an individual? And so reinforcing, listening, and communicating to organizations that are of this size, I think is the challenge. And then ultimately maybe to shift it a bit from trying to outcompete other health systems or other universities, but again, using this as a lever to partner, right? Working with Wayne State will still be very important to Henry Ford, still very important to MSU. For example, what they provide to the community is really, really important. So it's also not outcompete, but find ways to increase our capacity to be partners in making a difference.
Okay, we need to take a quick little break. We'll come right back with some more questions right after this. And welcome back to Spotlight. Dr. Beauchamp, I understand that part of the model for what you're doing here in Southeast Michigan with Henry Ford Health System is similar to what you've done on the west side of the state over with Spectrum Health and what you're also doing down in the Lansing area. Talk a little bit about that, and what does this mean in terms of the big picture of how healthcare is changing across the nation and across this state?
Yes. Michigan State is a community-based medical school. So we partner in our educational mission in many communities. And part of what we believe is that by increasing the number of practitioners that are patient-family centered, that come from diverse backgrounds, we'll better be able to address health disparities. Our work in Grand Rapids, one of the things that's been unique about that is the concept of a public-private partnership, which is when you have clinical care education and research, and then you bring in companies, right, that are going to find new ways to take what you invent and bring it to the world. It has a lot of positive effects in terms of job creation, economic development, and moving care quicker to patients. And what we're really excited with Henry Ford is because a part of this will be connecting to their huge health delivery system, we'll be able to develop innovations that will improve access and lower cost in healthcare in a way that, again, brings economic development to the community as well as job creation. And what ultimately I think it means, going back to your specific question, is we believe that the state of Michigan should be recognized for being a leader in innovation in health, really a place that's helping define the new ways to provide care for all and bring it to people more quickly.
Sure. Dr. Munkar, Dr. Beauchamp just touched on it, and you're right. For that average person at home, they're saying, okay, so what does this mean in terms of my access to health care? And does it mean that my bill when I go to the doctor is going to perhaps be cheaper?
So first, I'll start with access. I would say absolutely. The goal is how do we provide the best access to our patient in the comfort of the place that it's important for them. So some of the things that Dr. Beauchamp and team and our team has been looking at to say, when do we need to see patients in person? When can we do it in a digital fashion, in a virtual fashion? What are data points that we have at the present time that will allow us to predict what problems a patient might see? So we really are looking at the present time to see how patients can access us in a better way that is more comfortable and patient-centered than we have had done in the past. So this is going to be very important. The other thing, as we look also at part of our work, is going to be focused on what we call the health of our population. So how can we provide health to the communities that we serve, one person at a time, but also try to decrease the cost of care? We have started to do that at Henry Ford Health System for a while at the present time, but having the data science research that Michigan State has had at the present time, as well as combining the lessons that we've had in urban setting in the city with some of the things that we've seen in rural areas, this is what's going to be very important in the future. How do we treat each population the best way in the setting and environment that they live in?
If I may, just adding so that
Sure.
Perfect, is that
Go right ahead.
some of this will be one, lower cost by better prevention. And so that'll be a part of our work. And as Dr. Munkar said, some of our work will be looking at social determinants of health and how do we address some of the issues like poverty and better access to education. And by not just focusing on care in the health system itself, but taking it to the community for prevention and education and learning from the communities what they need, we think that's also a way that we're going to lower the cost of health for people significantly.
Okay, gentlemen, hang on for just a second. We'll come right back with a final important question about how all of this is impacted by insurance and politics. Stay with us. Both of you could tackle this. So much of what happens in terms of healthcare, and especially as we move into the future of healthcare, we have a new administration in Washington, has to deal with insurance and politicians and legislation, whether it's Washington or it's Lansing. What's your message to both of those large entities to make sure that what you've just put together here in terms of a partnership is a success going forward? Dr. Munkar?
Yeah, so I really think this partner reflects the importance of collaboration to transform healthcare. As Norm has mentioned earlier, we need to come together to be able to deliver the needs that our patients and community has. We need to take barriers away so that our patients and community have better access to healthcare. We've learned this from COVID. I mean, the COVID crisis that we've lived at the present time is extremely important. So the ability for the administration as well as payer to help fund programs and projects that are able to help us drive the health of our population is going to be very important. We talked about cancer. Our focus on cancer is to provide the best cancer care from the best specialists, but also to have access, to provide access to our vulnerable populations for people who might not have had the access before or who have not had the means to have the support, care support that they need. So in addition to the care, that support as well as funding and taking barriers away that exist at the present time, either from authorization perspective or funding perspective that are important to drive care.
Dr. Beauchamp, you get the final word on this.
Well, thank you. There's a great saying, Helen Keller, alone I can do so little, together we can do so much. And it really is to state, local, and federal government, let's work together on this in trust, because our goal of serving the people is common. And I think historically, we haven't worked together in ways to go after the social determinants to the extent that we can. And we're very enthusiastic about the shared recognition of the need and the opportunity to address these imperatives together.
Dr. Bankar and Dr. Beauchamp, representing Michigan State University and the Henry Ford Health System, thank you so much for joining us. Best of luck with this partnership, and would you stay in touch with us? Let us know how it's progressing and anything that you may need from our end in terms of helping to get the word out about why this is so important.
Pleasure. Thank you.
Absolutely. Thank you very much. Thank you for having us.
Thank you so much. It's our pleasure. Stay safe. And when Spotlight returns, we'll remember Karen Hudson Samuels and the legendary Mary Wilson. We'll be right back. Welcome back. This past week brought plenty of political fireworks in Washington, D.C. and Lansing.
Fight like hell. And if you don't fight like hell, you're not going to have a country anymore.
Senators, this cannot be our future. We can't be thinking about that. We can't possibly be suggesting that we punish people for political speech in this country.
Senator Shirkey. Good morning. Morning. Sam Ingold, Progress, Michigan. Any plans on heeding some of the calls and resigning after the video that got released yesterday?
No, I don't have any plans for that, Sam.
The video, Hidden Camera, released by Hillsdale County Republicans, showing Shirkey calling the January 6th insurrection a hoax.
That's been a hoax from the day it was part of it.
Shirkey Tuesday released this statement saying in part, "I regret the words I chose, and I apologize for my insensitive comments." Outside a fundraiser this morning, Shirkey clarifying those comments.
You really think it was a hoax, that it was staged?
No, what it was a hoax was the fact that it was blamed on Trump, not the actual event. It was very real and very, very unfortunate.
And it also brought us the passing of two influential women with strong Detroit roots. First, Karen Hudson Samuels. Her passion for Detroit and history was unmatched. She was a devoted member of the National Association of Black Journalists and used her public relations expertise to promote numerous people and events. She used her skills and persuasion to establish the William V. Banks Broadcast Museum and the WGPR-TV Historical Society, honoring WGPR, America's first television station independently owned and operated by African Americans. And just a few days ago, she proudly announced that after years of hard work, the historic TV station was approved by the National Park Service to be on the National Register of Historic Places. Karen Hudson Samuels, a job and life well done. And of course, there was Motown recording legend Mary Wilson, who got her start and fame with the legendary and world-renowned female singing group, The Supremes. As a teenager growing up in the old Detroit Brewster Douglas housing projects, Mary Wilson co-founded the hit-making Motown Records trio and stayed with the group until it dissolved in 1977. But in its heyday, Diana Ross, Florence Ballard, and Mary Wilson took the music world by storm. They were known as the sweethearts of Motown, as they trailblazed their style and sound into the mainstream of society. At one time, they were Motown's greatest commercial success. They personified grace, glamour, and musical perfection. In the 1960s and 70s, they were the standard by which all other female groups were judged.
Ooh, child, things are gonna get easier. Ooh, child, things will get brighter. Ooh, child, things are gonna get easier. Ooh, child, things will get brighter. Someday we'll put it together.
Later in her career, Mary would successfully perform as a solo act and parlay her fame into books, television appearances, and several other business ventures. But to millions across the globe, Mary Wilson will always be remembered as an outspoken and steady vocalist who reigned supreme.
I believe in you and me. I believe that we will be in love eternally, as far as I can see. You will always be the one for me.
Mary Wilson visited Detroit often. She died last week at age 76 in Nevada. What a musical talent indeed. She'll be missed. That's it for today. Have a happy and safe Valentine's Day. I'm Chuck Stokes. We'll be back next week with more newsmakers in the Spotlight.